perro caliente aquí ni nada. No hay nada que comer, no hay perro caliente. Increíble. Secretary about Oye, ¿y un perro caliente aquí? No.
¿Cómo qué?
Ni un perro.
Well, good morning. I want to thank FIU for hosting us for today's discussion about coronavirus in Florida. I also want to thank Secretary Mary Mayhew for her hard work. I want to thank Mayor Carlos Jimenez. I've been working with him closely for months now. He's been doing a great job. And then also want to thank our hospital executives for being here from Palm Beach, Broward, and Miami-Dade, and we appreciate you guys. I'm just going to go over a few things real quick, and then we'll get into a discussion in terms of what's going on in the state of Florida. Let's see. There we go. Yeah. All right. So we've now done over 1.5 million individuals tested. We're doing it at a clip now that, hopefully we can reach 2 million very soon. And I think that that's good. Right now we're about one test for every 15 people, which is a pretty good clip, and we're going to continue doing that as we go forward. I think one of the things to look at the trends that's very important is what is the median age of those people who are testing positive. And the reason why is I think we know now, after having dealt with coronavirus for all these months, that the mortality and morbidity is very closely linked to age. And those under 40 in particular, who don't have any significant underlying conditions, are much, much less likely to be hospitalized or to suffer a fatality. When we started this, the median age, I think, was in the 60s in the state of Florida for the test. Now, there wasn't a lot of tests being done. Then it slowly went down to get into the 50s. But then what we've seen over the last couple weeks is really a dramatic decline of that median age, so that as of yesterday, or last week, the median age of all the positive tests in the state of Florida was 37. And I can tell you, with the cases we're seeing today or this week, which have been increased cases, that median age is plunging even further. So for the results that came out today for 6/18, the median age of positive tests is this in the following counties: Broward County median age is down to 33, not for the whole pandemic, for today's results. Duval today, median age of 30. Hillsborough, median age of 31. Seminole, median age of 26. Orange County, median age of 29. Dade County, median age of 41, and Palm Beach, median age of 40. So that is a very consistent trend. I'll talk a little bit more about, what we're seeing in those numbers. So there we are for this. It's going to continue to go down based on what we've seen over the last several days. Huge numbers of people, particularly in that 20 to 30 cohort, who are testing, but then testing positive. 62% of all new cases in Florida for the week of June 7th are under the age of 45. Again, from what we're seeing, I think that percentage is going to increase once we get this week's results in. That is a big change from where we were, say, at the end of March and the beginning of April. It was skewing much older at that time. It's important to also understand, and I thought this new study that came out, they looked in Italy and they looked at serum samples of 4,300 contacts of index cases, and they found that 69.1% of infected individuals under the age of 60 had no symptoms. Now, this is one study, but I think a lot of other studies have been very similar. Why that's important is I think it's important for people to understand a lot of the people who are testing positive now are not symptomatic. And I think the hospital execs will talk about they test people, anyone who comes in for procedure, and those who test positive are almost always asymptomatic. And so particularly in the younger cohort, you're finding infections with minimal or zero symptoms. That's a little bit different from what we did at the beginning of the pandemic. We were talking before we came in, if you were somebody that was 25 and you were not symptomatic and you wanted to go to like a drive-through test site in March, you would not have qualified to get tested. Part of that was the CDC guidelines. Part of that was the resources were less than they are now. So that was really focused on those folks who were most likely to suffer clinical consequences. So when we first did the big site in Broward County with the National Guard and Memorial Healthcare, we had first responders and healthcare workers, but then symptomatic individuals age 65 or above. And that was the screen. As we started getting into April, had more capacity, started lowering that age, still required the symptoms. Now what you're doing is you're testing anyone that wants to test. No requirement that you have symptoms, at least at the state of Florida sites. And so you're definitely seeing a different complexion in terms of the ages of people who are being tested. Here's a look just to see for comparison. The week of April 5th, there were almost 12,000 tests conducted, people ages 25 to 34. This past week, there were almost 3 times that many tested in that cohort. Obviously, there were more positive cases, found as a result of that. And then compare 65 and plus. You had only 16,000 cases or tests conducted week of April 5th, but 1,800 positive cases. This past week, we had almost 71,000 tests conducted, but only 1,464 positive cases. That's going into these nursing homes, doing blanket testing there. Obviously, anyone that comes and presents as symptomatic, but to go have that big of an increase in tests and then actually have the positive cases decline, that's a very, very good sign. Here's one thing to look at, and I think, I said from the very beginning when we started really increasing the infrastructure in terms of phase 1, I said, look, there's going to be workers that go, just their employer says to get tested, people are going to go. You're going to find more asymptomatic cases. As you test more, you find more, and that's basically been something that we believe from the beginning. So I said back in April, you're going to see Florida, if we're testing 30,000 a day, you're going to see us identify 2,000 plus cases. That's not going to be something that's unforeseen. And I think that's true, and I think that's part of what we're seeing now. But I also think you look at, and I think this week too you look at this positivity rate, there's a big difference that's developed between the positivity rate for people that are 65 and up, who are the most at-risk age group, and then the other demographics. And you're starting to see increases in the positivity, particularly for those under the age of 45. So that's something you're looking at, because if you test 2 weeks ago 5,000 people and get 100, and then you test 2 weeks later, you test twice as much and you find twice as much, that's kind of what you expect, particularly if most of these are asymptomatic. When the positivity is going up, that's an indication that it's circulating more, at least amongst those age cohorts in the community than it had been previously. So that's something you're watching. I think you've seen an increase in the positivity the last few days. I think it was even 10%. We've typically been around 4% statewide. Last week, you started to see that inch up because you had some discrete outbreaks. You still have some of that, but you definitely see in that 25 to 34 category, and actually even in probably the 18 to 24 as well. You're starting to see more positives regardless of the number of tests. So that's something that we're obviously keeping an eye on. Fatalities by day in Florida, we've showed this before. We've not had anybody COVID-related under the age of 18 or under, which again shows the age stratification with how this disease does. And we have 86% of all the fatalities in Florida have occurred in age 65. I guess that got cut off at the bottom, in age 65 and plus cohort. And we have had more fatalities age 90 and above than age 65 and under. So it's a very clear stratification in terms of the consequences. And so because of that, we've really worked hard with the long-term care facilities. We've now completed, either tested or offered a test to every resident in the state of Florida, as well as staff. We are happy to have done that, and I'll go through some of the results of that in a minute. But we also understand you can test somebody one day, they can come back negative. It doesn't mean that they can't acquire the virus later. So we've issued this emergency rule requiring testing at least every 2 weeks of all staff in long-term care facilities in the state of Florida. And that will help us prevent the introduction of the virus into these facilities. Many of them have done a good job of that, but when you have asymptomatic spread, you need to continue to do that. We also have dedicated nursing facilities that are in use. We're going to have one in Miami-Dade very soon. So these are COVID-only nursing facilities. If you look at the hospitalizations, and we'll go through the general numbers, but on any given day, because we require nursing facilities to transfer patients to areas they can be isolated if they're COVID positive. And many of these facilities just can't isolate. So if you don't isolate, it spreads, and that's obviously the most high-risk community. So this gives the opportunity to transfer a COVID positive resident of a long-term care facility to COVID positive areas if that person does not need to be hospitalized, medically stable but COVID positive. And there are actually a number of these seniors who are up in years, and they're even asymptomatic, or some have minimal symptoms. So this gives opportunities, whether it's Dolphin Point in Jacksonville, Inspire in Broward. Now you're going to have Pan American very soon. That gives an option for that. It also allows a hospital, if somebody is brought in from a long-term care facility and they're medically stable, they have a safe place to be able to discharge them. But we've basically had between 250 and 450 of the COVID hospital beds at any given time have been kept since we did May, when we did the elective procedures and instituted this rule, has been these medically stable COVID positive nursing home residents. If you look also at the fatalities broken out by long-term care residents versus the general public, you've seen really since probably towards the end of April that these long-term care deaths have represented the vast, vast bulk of the COVID-related fatalities in the state of Florida. I mean, we've got, close to 5 million seniors in the state of Florida, and yet the majority of the fatalities aren't from the senior population as a whole, really from that cohort, that very high-risk cohort. So we went through and did the testing, and obviously people were being tested right off the bat to the extent there were symptoms initially. But as we got into April, we realized that, okay, we had screening, we had no visitation, we had all these things in place, and it was effective in a lot of them, but you did have asymptomatic spread that the staff would bring in for the and infect some of the residents. And so you started to see outbreaks, saw them in like Suwannee County, we've seen them some in South Florida. So we thought it was important to test the residents, to test the staff. And so we've gone through with the strike teams, private contractors, all these different things, and done this. And right now we have about 80% of the more than 4,000 long-term care facilities in the state of Florida have never had a single COVID positive case. We've had 933 that have had one or more, but I believe the majority of those that have had one or more have had fewer than 5. So a lot of these facilities did a very good job. This is a very transmissible virus, and to have 80% never even have a case, much less a fatality, was really good. And so that's very important. And you see also one trend that we've noticed. We are seeing decline in cases in long-term care facilities. We're seeing fewer outbreaks. I mean, there was a time in April, May, it seemed like, every other day there'd be some type of outbreak. You still have some cases, obviously, but there has been a decline, which is a good thing, and those are the patients that are going to have the highest acuity. They're going to be most likely to be hospitalized if you do have an outbreak. And as I mentioned, we're between 250 and 450 medically stable long-term care residents are in hospitals. They don't need to be hospitalized, but it may not be safe to have them in their facility if they can't be properly isolated. Okay, so bed availability. We have twice as much capacity in the hospitals throughout the state of Florida today than before the pandemic began. And that's with having elective surgeries, which have been going on since the beginning of March. And you see it, every which way. The total number of COVID patients statewide has always been a small fraction of the total hospital beds in the state of Florida. So there is capacity. The hospital execs will speak to this, but there's plenty of capacity here in the state of Florida. And we knew, there was a lot of predictions that Florida's going to run out of capacity in the middle of April. Obviously, that didn't happen. But then right now, even with the elective procedures, in a much better position because we have ample testing resources, ample PPE, know more about the illness. So things are all these folks I think are in really, really good shape with that. So mitigation efforts. What we're seeing is increased cases in mostly asymptomatic, but increased cases in a younger cohort. We've messaged from the beginning of March that those who are elderly or have significant underlying medical conditions, need to be avoiding crowds and avoiding contact outside the home as much as they can. And I can tell you, the seniors in Florida have done a really, really good job. You don't have that low of a positivity rate unless that's the case. So they've done a really, really good job in terms of the social distance, in terms of making sure they're looking out for themselves. I think that we've started to see, some erosion in the social distancing from probably some of the younger population. So the Department of Health is going to be launching some public service announcements, reminding folks of some of the things that you can do. I mean, if you're just a normal, healthy, younger individual, doing things like frequent hand washing and sanitation, staying home when sick, social distancing, and wearing a mask, when you can't social distance, those things are very, very important and can help reduce the amount of transmission that we're seeing, particularly in those age cohorts. So I want to turn it over. We'll let Mayor Jimenez make some comments, Secretary Mayhew, and then we'll hear from our hospital folks, and we're just going to have a little discussion.
Thank you, Governor, and thank you for coming and putting us together. I want to reiterate that we don't have a hospital shortage in beds problem here in Miami-Dade. Yesterday's dashboard indicates that we had 2,696 beds available, critical care beds, with the ability to put another 1,200 in operation fairly quickly. We have 442 ICU beds that are vacant, with the ability again to put 526 additional, which means close to 1,000 beds that we can put in operation very quickly. 847 ventilators. We have 644 people with COVID-19 in the hospitals today. 121 of them are in ICU, and 523 are in critical care beds or lesser beds. And we only have 60 people in Miami-Dade County that are on ventilators right now. So none of these numbers are alarming. What I have instituted in Miami-Dade, because we did have a rise in the positive rate, is that we again are going to be accentuating and putting to the forefront enforcement efforts to make sure that people keep their social distance, wear masks while they're indoors, follow the rules, and we're going to do this with our police officers and code enforcement personnel. Governor, we've conducted over 300,000 business checks in the last month. We have found a high level of compliance, but we have seen a little bit of lax enforcement, maybe, and maybe the younger folks don't think that it's quite as important, and so we're going to be cracking down on that here in Miami-Dade County. And so, again, the reports that somehow we are running out of hospital beds is incorrect, grossly exaggerated. We've been at this number of empty hospital beds or available beds of around 2,700 for quite some time. We've been at the number of over 800 ventilators for quite some time. We've been around 60 people on ventilators for quite some time, and so we don't see this. This is concerning that the positive rate may be going up. That's why we're going to be cracking down on enforcement, but it's not alarming. And so we always expected that as we open the economy, we would have more positive rates. That was to be expected. But we also feel, I had a conference call with our medical experts yesterday. They also agree that we're not going to go back, that enforcement of the rules that we put in place, that we took a long time in formulating, is the key to our success. And so that's the steps that we're going to be taking here in Miami-Dade County, and I want to thank you for your leadership for the state of Florida. Thank you.
Great. Secretary Mayhew.
Thank you, Governor. I think from the very beginning, you have been clear that there's a difference between panic and preparedness, and you have had laser beam focus on protecting our most vulnerable, our elderly, our medically frail. And we've also understood that it was critical to monitor our healthcare system's capacity. So we have taken steps long before many other states to protect our elderly in the most vulnerable setting. We have nursing homes here in Florida and certainly in Miami-Dade and Broward, facilities that are 40, 50-year-old buildings. They are maxed in their occupancy, awfully difficult to isolate in those buildings when you have memory care units. And so we have worked to establish these dedicated facilities. We never had false expectations about the ability of some of our long-term care facilities to be able to isolate. That allowed us to take swift action early on to move individuals, to work cooperatively with hospitals to protect our elderly. I am grateful to the hospitals here in Miami-Dade and Broward and Palm Beach. There has been a level of collaboration among the hospitals. I don't know how many phone calls that I have been on routinely over the last many months where data has been shared, where discussions have been coordinated. There has been not only a level of preparedness, but an increased focus on what surge capacity truly looks like in our hospitals. We've drilled down on how many beds our hospitals could bring online in 48 hours. So we focus on the beds that are staffed currently, but what we know is that our hospitals have an incredible ability to rapidly increase their capacity, and that is often overlooked by the media as they focus in on current capacity. So really, really impressed. You know as well that we mandated that hospitals test every single individual who is scheduled to be discharged and placed in a long-term care facility. That has also contributed to our success. So we know we have More than 15,000 available beds today in Florida. The trends are absolutely favorable. The acuity is down, and it is a tribute to the incredible dedication and commitment of our frontline staff, of our hospitals, of our long-term care facilities. We've had some incredible regional collaboration that has supported the best interests of protecting our most vulnerable and making sure that we have adequate capacity throughout the system. I think it's also important to underscore we have a lot of individuals who have delayed critical health care services that we want to make sure they have the confidence that they can, in fact, come to the hospitals to get that needed health care. So thank you, Governor.
Great. Mark Rosenberg, do you want to say a few words? We appreciate you hosting us.
Thank you, Governor. First of all, welcome to everyone here. Really pleased to welcome the Governor and the Secretary, as well as the Lieutenant Governor, who is returning to her alma mater. Also pleased to welcome other alums who are here, including two on our panel. Mr. Governor, I speak on behalf of the state university system and higher education in general. We understand that we have to remain focused on student success, but at the same time, sir, we know as universities and in higher education that we have an important role to play in restoring our state and national health on one hand, and driving prosperity through employment generation, through wealth generation, and closing gaps in health education and well-being. And we appreciate very much the approach that you have taken to working with us. As you know, our state university system is ranked is the number one system in the United States because we've been laser focused on student success. We've had strong leadership from Chair Kitson and our Chancellor who have helped us to work through what has been a remarkable transformation in response to this virus that has hit our state. We converted overnight in higher education practically overnight, over 50,000 courses, sir, to remote so that our Floridians can continue to get their educations. We graduated nearly 50,000 students in April and May, and now as a system, we are laser focused on a safe initiation of our fall semester and the resumption of classes in the fall that will be a new normal, as you know. We can assure you that we are working very closely with your office and on behalf of our university, even though as you are here today and you do not see students, over 42,000 students are actually enrolled in classes and taking classes remotely through our FIU so they can continue their educations and get back into the workforce. We are looking forward to a fall, if you will, presence on campus that is robust, and we will continue to offer courses and make education available to Floridians as you have as so clearly directed. I do want to welcome our chair of our board, Dean Colson, who is here with us this morning, as well as our Dean of Public Health, Tomas Guiarte, our Dean of Nursing, Dr. Ora Strickland, and our Dean of Medicine, Dr. Robert Saxteen. And I do want to thank the Mayor and the Department of Health for enabling us to offer testing. We've tested over 15,000 Floridians as part of our contribution to helping to resolve the problem, as well as we have many other initiatives engaged in trying to keep our community healthy. So thank you for being here. Thank you for your confidence in us.
Great. Well, thanks for your hard work. I will hear from some of our hospital execs, and then we'll just have a conversation. So Carlos Magoya, Jackson Health in Miami, thanks for working very closely. I know Mary's worked with you day to day, and we've worked together, and I know you've been working with the mayor here. So you guys got a very big county, a lot of stuff going on, but you guys have done a great job, so the floor is yours.
Thank you, Governor. As Secretary Mayhew stated, we have been having a lot of communication, coordinating between all the South Florida hospitals in Dade, Broward, and Palm Beach, where we've been sharing information since mid-March as to what's going on, everything from potential surges that we didn't have, but all that work has been done. So basically at this point in time, we've been more than prepared from that standpoint. We've also been working together on the reopening and even done advertising as jointly as hospitals, which is something never heard of because it's always the competition that we've had among hospitals. I can tell you that, and the mayor already talked about the Miami-Dade availability. I will tell you specifically as it relates to Jackson, that today we have 150 COVID patients, of which 45 of them are in intensive care beds. I will tell you that both in the med surg as well as the intensive care, if we were to double that number, we would still have additional beds available today. For anyone to look at our total ICU beds and figure out what percentage, it's not a proper number. Why? We have the largest transplant program in the country. We have a huge neurosurgery team. So there's an awful lot of complex things in a tertiary quaternary hospital like Jackson Memorial that really is not fair to look at Jackson Memorial or our system on a percentage basis. So we are more than prepared to do that. And frankly, in part of the conversations what we had, and our partners here, Maggie and Aurelio, have been a part of those conversations. We feel very comfortable that we're ready to prepare to do anything that we can to continue in the environment. And with that, I think I'd pass it on to Aurelio.
Yeah. So we got Aurelio Fernandez, CEO of Memorial Healthcare System. They've been great working directly with my office when everyone wanted to get tested, and then obviously it was tough getting those kits in February, early March, and then finally we got the National Guard there and we set up a drive-through test site. At that time, any of the drive-through sites throughout the country, a lot of them just failed, and so we said, we've got to get it right. We want people to have confidence. We don't want them, so they did it, and that's probably they've actually had National Guard leaders from around the country come and scope it out to try to get best practices. And obviously the Guard did a great job, but Memorial has just been phenomenal in doing that, and that is probably one of the most well-traveled sites probably anywhere in the country, and I think evidently you've seen a decline in the age going through, because with 33 being the median for today, I mean, that's obviously much different than when we started, but that's a good thing. So go ahead.
Thank you, Governor. And one of the things I like to say is that today we're much smarter than we were back in March and April, and we've been able to retrofit our hospitals to rapidly convert some of our patients' room to a negative pressure, which means we can utilize them in the event that we have positive COVID. Just to give you an example, in mid-April, we had 189 positive COVIDs. Today, we had 143. But more importantly, critical care patients, we had like 33. Today, we had 14. And the use of ventilators are like all gone. We only had 11 today. So you're seeing a decline in the acuity of patients, and therefore, being a younger population, the likelihood of them requiring critical care services is more remote. I also got to give credit to the Secretary for participating in the call. So I need to echo what Carlos said. I have been in this business over 40 some odd years, and I have never, ever seen the collaboration between all the hospitals who are always been competitors with a single mission, and that is to provide the community with a level of care to avoid potential spread. The initiative that took place to look and support our nursing home industry was paramount. And we have seen a huge decline in the number of patients coming in, or residents coming in from the nursing home industry. And like Carlos, we have excess capacity. I think we need to define what is capacity. And we do not, as an industry, staff empty beds. We staff hospitals when you have a patient. So I do not know where the media is getting this information. But if we have to ramp up, we have the ability to ramp up and take care of whatever is necessary in the community, not just for COVID, but for any kind of surgical procedures, any kind of elective work. So thank you for your guidance, and thank you to the Secretary for his job.
And just it's a good point about kind of how it can be characterized. So in April, I mean, you said you had more COVID patients than you do now, but if you looked statewide, and probably true for you, there was like 40% of the beds were available. Then the elective surgeries come in, so you start to see more people in the hospitals, and then so now it's 25%. But that's mostly for things other than COVID, correct?
Absolutely, yeah. Absolutely. COVID is less.
Yeah.
With more census, so.
Right. Okay, well, good. Well, thanks for all your hard work. And Maggie Gill, Palm Beach, Tenet Healthcare, thanks so much for coming, and the floor is yours.
Well, thank you, Governor, and thank you for inviting me here today. And Thank you, Secretary Mayhew, for your partnership and for providing the update on the data, because I think that it's a very important framing as we talk about why we're here today. And my message is the same as my colleagues, that we're safe, we have capacity, we have resources, and all 5 of my hospitals have the ability to take care of COVID and non-COVID patients in a situation that is completely manageable. All of our hospitals have surge plans. We can adjust to any fluctuation in COVID volume. We have successfully reopened elective care. We have capacity, and we have PPE. We have trained staff. And as Aurelio said, we are much smarter in terms of how we manage patients today than at the beginning of this pandemic in March. So we encourage people to seek care when they need it. We have seen people defer care, which is an unfortunate byproduct, I think, of this entire event. And so all of our hospitals are ready to take care of the people in our community, and we encourage them to do so. I want to thank you, Governor and Madam Secretary, for your steadfast support of our healthcare system. I think as a state, we have worked really well together to make sure that we stay ahead of things, partnering with our assisted living facilities, communicating with EMS and our first responders, and really acting like a unified network of care to make sure that we're being proactive in our community. So I thank you.
So when you look at your system in Palm Beach, and you think about the people that were hospitalized in March and April versus now, generally, has there been a decrease in like the average age and acuity, would you say? I know others have said that that's what they've seen.
Our trend would reflect the data that you show in our 5 hospitals, where it's the average age is lower, the ICU utilization is less. We're testing more people. And so we're getting more results, and that is better for everyone because we can better determine how to prevent the spread. But certainly it's a different situation than it was back in March.
And that's reflected statewide. I mean, we have had way more people in the ICU in April statewide than we do now statewide. Can you talk about my wife and I had a baby at the end of March, went in, just kind of, was obviously people were limited, but she wasn't tested for COVID at that time, obviously. Well, now we have more testing resources. So hospitals, if someone's going in for a procedure other than COVID, are you testing everybody who goes into the hospital for those types of procedures?
We are. So if you're a delivering mom, we're going to test you. If you're coming in for an elective procedure, we're going to test you. If you have any respiratory symptoms or become symptomatic while you're in the hospital, we're going to test you. So our testing capacity is much broader than it was. And so your OB example is a perfect one because today when we test people, sometimes we get moms who are asymptomatic but test positive. Those are in our numbers, and we care for them, with the appropriate staff and appropriate PPE. But that allows us, that is just additional information and additional testing data points that we did not have at the beginning of the pandemic.
So when folks are coming in, whether it's to give birth or other things, and they're tested for COVID, they test positive, are they generally just asymptomatic carriers?
It really depends. We have patients who are hospitalized who are symptomatic for sure. We have some that are asymptomatic, and we have some that are awaiting discharge. So it's a mix. The majority of our patients are still, ill, but it's at a lesser acuity than it was at the peak of the pandemic.
But what about just the people who come in to test for electives? If they test positive, obviously they didn't think they had COVID before. Do they tend to be the asymptomatic folks, or does that run the gamut?
It's a really low percentage that test positive. And we give them all of the proper advice to self-quarantine and to take care of themselves in that manner. But it's a relatively low number of people who are coming in for elective care who are testing positive.
But to that point, if they're testing positive and coming in for elective surgeries, they're not being admitted if they're asymptomatic. They're sent home and wait until afterwards before they come back in for an elective surgery. Obviously, if you're an expecting mother and you're going to have a baby, we can't just send you home.
So how do you do that? Do you take them to a COVID section, or do you just have a negative pressure room?
So what we with the expecting mothers, if they're positive, they're definitely isolated. And to that point, by the way, as of a week ago, I haven't seen the numbers recently, we've had 10 different positive tested mothers who had their babies, and their babies were all negative. So it's another issue, which is important, that just because the mother is positive doesn't mean the baby is positive in this particular case. But we, in every one of us, we isolate all the patients, whether it's in a negative pressure room or they happen to be in a completely different wing. They're completely isolated from everywhere else. And because the percentage is so low, I mean, 10% of our beds are COVID positive, so obviously 90% of our hospital is perfectly safe, and that's the case with just about every one of our hospitals, that we make sure that those people are isolated, and people that are coming in for elective surgeries don't even see a patient that's COVID positive.
Really, have you seen a difference in Broward in terms of the age or acuity of the patients who are being admitted to the hospital now compared to maybe March or April?
Well, absolutely, and I think it's reflective of the number of ICU patients, critical care patients that we had back in April, and it just happens to peak in mid-April, as you referred to, in the whole state, to today. I mean, to only have 14 patients with only 11 ventilators is way improvement over prior, and I believe that's a reflection of the age that is being seen at the hospital.
Are you guys using, I know we work with HHS for the remdesivir. Are the physicians using the remdesivir, and how's that worked out?
So we've been working, we all been working directly with your people in coordination on remdesivir as to when the right protocols. And typically it's been for patients that are on ICUs at a certain level, and we've definitely seen a positive reaction to that. That's one of the only ones that we can really say, you know, there's been a lot of speculation, a lot of different medicines, and we really don't know. It's too soon to rate, but in remdesivir, we've actually seen a very positive return on those patients that are in ICUs that have been getting remdesivir.
We've also seen a positive results in plasma transfusion. We have done over 96 since March, and I do believe that has helped. There is no real cure right now, but what we've learned, for example, we are using high-flow nasal cannulars instead of ventilators, and we're processing five times the amount of oxygen to the body, where back in March we were not using it. We were dependent on ventilators. So we are much smarter today. We're really elevated the level of care, and the intensivists that are in our units 24/7 also helps in our ability to care for those patients. We've had over 790 some odd patients that have gone home when they were COVID positive.
Aurelio's point is a very good one. We learned, not just we in South Florida, but everyone learned from what happened early on in New York City with the ventilators. And our research team from University of Miami and our critical care started moving the protocols for ventilators much later in the intensive care unit. By doing that, we actually came up with much better outcomes. So our outcomes right now for patients coming into the ICU are much higher than what you've seen anywhere else in the country, because we've learned over the last few months about this disease and gotten better at it.
Yep. Are you guys also using the remdesivir?
Both remdesivir and the plasma therapy, and I would echo the comments of my colleagues to say that both have had positive results for our patients who are in the ICU.
Are you guys going to use that steroid that's been talked about now? I know that there was some type of study that came out. You know what I'm talking about, right?
Sure. And that's been used. The steroid is available everywhere. We have not tracked as to compare the clinical trials in England as to what we're having here, but it has been used. It's been in the formulary for years.
Right.
You know, Governor, the other thing that I was going to add that Maggie and the others can speak to, you know, we often hear about the healthcare system being very siloed, very fragmented. And what I have been so impressed with has been the outreach from the hospitals to the nursing homes and the assisted living facilities to share best practices around infection control. And Maggie, I know that you've been really aggressive in supporting that effort in Palm Beach. Could you speak to some of the specific work that you've done?
Absolutely. As the leader of the largest health system in Palm Beach County, and with the number of elderly that we have, we understand the concern that the assisted living facilities have for their residents. And so we took the approach early on that we need to partner. And we reached out and we developed a collaborative where our 5 hospitals and the assisted living facilities in Palm Beach County could share our goals, share best practices, And we even designated a clinical team from our hospitals to partner with their teams to share the experiences that we've had, because obviously we're more practiced at managing COVID patients and isolating those who may be asymptomatic positive coming through this testing protocol. And so we've kept up that dialogue. We've done a number of site visits, and so far the approach has proved to be pretty successful.
You have anything to add? You have any questions for any of the folks? I know you're...
No, not really, Governor. I think that, our hospital systems are working very well together. They give us all the information that we need to keep us abreast of what's happening inside the hospital. And also, Secretary Mayhew, you've been a tremendous help for us here in Miami-Dade County. And like I said, the message is we're going to be serious about the enforcement actions that we need to take. Younger people tend to think that since it doesn't really hurt them, that it's okay to do and not wear the mask. But our concern is that, yeah, it obviously the younger you are, the less that this disease is going to hurt you, but you can take it home to your parents and you can take it home to your grandparents. And one thing that we have done here in Miami-Dade County that I'm really proud of is very early on, we stopped those congregate facilities. We started feeding our seniors at and home. It's a program that's going to cost close to $75 million once we tamp it down, and we are starting to get away from it, but we're making sure that those seniors are going to be provided by some other agencies to get those meals at home so that they stay at home. Our message again is for those 60 and over, those with underlying medical conditions, the safer at home guidelines orders are still in place. You are safer at home. We are going to continue to open up the economy. Right now, we're taking a pause while we, try to assimilate these numbers, but we're not going to go back. We're going to be doing more enforcement, but we're not going to go back because we can't go back. We need to move forward, and so the information today is actually very informative as to the demographics of the folks that are coming up positive. Again, we have plenty of capacity here in Miami-Dade County. We are in much better shape now today than we were back in April, and that's the message.
Great. Secretary Mayhew, we were talking earlier about if somebody does go in for some type of childbirth or something and they do test positive, even if they're asymptomatic, that's considered a COVID hospitalization. And then also we've known that there's some folks that some systems use an ICU wing as, I guess, a COVID. So you actually have stable COVID patients that put in there, but they're counted as ICU just because that's the way the reporting's done. So even though we have far fewer people in the ICU today, that actually does include people who really aren't in an intensive care bed, right?
That's right. That's right. I think, first of all, it's important to take a step back and say Florida was prepared from day one because of the emergency status system that we have and the reporting that hospitals and nursing homes have been very disciplined about. So from the beginning, we've had real-time data at our fingertips to help inform the decisions. But throughout the last 100-plus days, we've continued to refine the information that we've collected. And to your point, we know what percentage of the admissions are from long-term care facilities. We know as we look at individuals who are ready for discharge but need placement in a long-term care facility. And we certainly have been trying to make sure we understand they may be in an ICU bed because that's their isolation wing, but not at that acuity level. The other point I want to make, and under your leadership, we've known that we can't make decisions in a bubble from Tallahassee. So the engagement, Mayor, I have so appreciated the ongoing dialogue with your deputy mayors. We've had numerous calls and conversations, and that level of feedback and engagement has helped to inform our responses, the resources we've been able to deploy, the engagement with the hospitals to respond to the boots on the ground perspective of what was occurring and what was needed, and that has helped to really shape our comprehensive approach.
Great. Any final comments?
I can only tell you that Secretary Mayhew has been extremely accessible to all of us here in South Florida, and Mayor Jimenez has really worked quite hard at doing all these things, and everybody, state, county, and the hospitals have all been continue to work together, and we are staying tight on this. We're confident that we're in the right place right now. We've been leveled off here for the last 4 days, and we're taking a day at a time as we keep working on this.
Absolutely.
No, I like to applaud the governor's office. The engagement from the staff has been extremely helpful in all of us staying focused, and the collaboration that we've said multiple times here has helped us be able to get ready, and we help each other. I've never seen competitors say, if you don't have the beds, send them over to us. That has never happened. And for that to have happened, it needed the collaboration from the agency, from the secretary, from colleagues like Carlos and Maggie. It's a unique environment where when everybody has come together for the betterment of the community, it's really impressive.
Maggie?
I want to thank Secretary Mayhew for being so accessible. We have transparency of data. We have a personal touch. She calls and checks in all the time. And as Aurelio said, we work together more collaboratively now, I think, as a healthcare community than we ever have. I want to thank you, Governor, for your leadership. And I know I speak for all of us to thank all the healthcare heroes that are taking care of all of our patients, the doctors, the nurses, the caregivers, the people on the front line. It's been a tough few months, but I think that we've managed it very well, and I just want to reiterate that we're all safe, we have capacity, and we're ready to serve.
Great. Well, I want to thank everybody for participating, and just to put a bow on it, we before the pandemic began, we have today, even with elective surgeries being online, and we have twice as many available beds statewide as we did at the beginning of March. And I think you're seeing. Hearing from these executives about where things are. Obviously, they have the capacity to be able to handle whatever comes down the pike. But you do have situations like a Broward, being down from their peak, and those are just the facts. And it's important that people understand that and understand that these are folks who've been working at this for months and months now. It's very, very good news when you hear them talk about the patients having less acuity than we saw a couple months ago. I think part of that is you're seeing a younger demographic, which maybe can handle the disease a little bit better. But I think a lot of it is they've really learned how to treat it, and I think that they've learned a lot and are doing a really good job with that. We put in a really robust testing infrastructure. Part of the reason we wanted to do that was because we knew as people were getting back to work, businesses were going to want their employees to be tested, and I think you're seeing that now in terms of with the demographics that we're looking at. And understand like a new case is just a positive test. It doesn't mean someone's sick, and in many cases, when you have it this low number of people, in terms of the age, a lot of them don't have symptoms, and there's a lot of them are not going to present any type of clinical consequence in terms of our healthcare system, but you are unmistakably seeing a lot of cases skew much younger. Now, in terms of clinical consequences, I've said before, if you have 1,000 cases under the age of 30, chances are there'll be less clinical consequences than if you had 100 cases from long-term care facilities. That's just the way this virus works. So the number of cases is not something that is necessarily going to tell you what the burden of the disease is. And to see these ages and this week continue to trend down, is showing that there are younger people going out to get tested, which we wanted to see, and you have cases. When you identify these cases, you're able to trace contacts and isolate people, and that's been done. Dade has done it. It's been done. I know they've been able to isolate the Homestead outbreak to one of the. There was a certain neighborhood, and so they were able to get people in there, test everybody. So having the ability to test allows you to identify way more cases than we would have been able to do previously. I mean, if someone had presented with symptoms and tested positive, say in the second or the third week of March, there would have been contact tracing, but they would have gone to the contacts and said, okay, you've been exposed, self-isolate, and then if you develop symptoms, let us know. They would not have just tested everybody because there just wasn't enough capacity to do that. So you have a lot of folks who are being tested who are asymptomatic. Now, one of the things I think we're going to have to work with is, yes, it's skewing younger, but these younger people are testing positive, at a higher rate. And so that's something that we're going to have to deal with in terms of some of the things that Mayor Jimenez mentioned. We're going to be doing, the Department of Health going to be doing public service announcements about the social distance, about the hygiene, about the, wearing the mask when you get close to people, things like that. And hopefully that will be something, that will register. But we have seen the trend down in terms of the age, but we have seen a trend up, particularly in that age group, with the positivity. And yes, it's a low-risk group, but if you continue to see cases there, the idea that you can just totally segregate the elderly from that infinitum, I mean, eventually, that's going to spread. So we want to really work on that, particularly with those demographics. But bottom line is, twice as many hospital beds available today than before the pandemic began. We are down on ICU hospitalizations significantly since April. And I think the folks that are going into the hospital now, fortunately, are skewing younger with less acuity. And obviously, we want to keep as many people out as we can. But those are folks that have, that have very good odds to have a successful recovery. So thanks everyone for being here. We can take a few questions, and I'm going to head on back to Tally. So we are not preempting any of that. I mean, I've told the mayor here, you got to take the decisions that you think are going to work well in Dade, and we've encouraged him to do that. We've put them on basically their own trajectory. And likewise, you have some of these other municipalities, that they want to do that. Look, at the end of the day, we put out an advisory at the beginning of May recommending per CDC that, you could wear a mask when you can't social distance or when you're in a face-to-face type business. When they do go that, and they have every right to do that, they're then responsible for the enforcement of that. And, our view has been to attach criminal penalties would not necessarily be the right thing to do. Yes, sir. Well, it's a good question. So questions about the budget, what would be on the table. I mean, look, you guys all know the budget was laid on the desk, I think about a week or not even less than a week before the 15 days to stop the spread. So you had a huge sea change because even though we knew we were dealing with coronavirus in January, monitoring it, testing people, monitoring people in February, you were as the second week of February, and some of the folks in Washington are saying, no, you're fine to go about your life, just take precautions. And so that's what the legislature was doing when they were going through that, and I think that was reflective of similar conditions than when I did my governor's budget. Now, obviously, it's changed, and I think we saw, we did gain jobs in May, which is a good start, but we've got a lot more to do. So I'd say, everything's on the table. I'm not going to sit there and say I already know I'm going to veto things in my budget. I've already made that determination. And there's going to be things that I veto that really, some of the things that were things that I thought were good for the governor's office. But I also understand, those are the front lines of what we're dealing with here. And so I can't guarantee anyone anything, but I'm sensitive to the burden that they're facing because they have the most at-risk population for COVID by far. And if you look now nationally, it's going to, if you do the numbers honestly, so in Florida, any resident of a long-term care facility who has a COVID-related fatality, whether they die in the facility, in hospice, in the hospital, counts in terms of that. And obviously, we've worked hard to reduce that as much as we can. Some states only count it if they die in the long-term care facility. Well, obviously, if they caught it there and they transfer the hospital and die, it should count as a long-term resident. So if you do an honest accounting I think right now, nationally, I know they say in the 40%, but if you do the honest accounting, I think it's well over 50% of the COVID-related fatalities in this country have been in long-term care facilities. And so we got to understand that, and we got to understand that that's something that's significant. I will tell you this, the plan that we're doing by mandating the testing for the folks who work at the long-term care facilities, we're paying for it. We're not expecting them to pay for it. We're footing that bill. It's not necessarily cheap. I mean, fortunately, we have CARES Act money that can be used to do it. But we really believe that constant monitoring of the staff so that they don't bring it into the facility is critical for preventing outbreaks. So we're going to do that. And so I just say that it's a priority. Yes, ma'am.
Local 10 News. I hear you on what you're saying in terms of the age and acuity, but at the end of the day, we are seeing an uptick in the amount of folks that are admitted to our hospitals, which, quite frankly, this means there's more sick people among us. Given your stated resolve to stay in this holding pattern of this phase section of the opening of the economy, does that mean that your mitigation efforts, the social distancing protocols that are the companion to that reopening, are failing?
So we have, as I think people said, I mean, we have far fewer people that are hospitalized for COVID ICU today than when we were under more stringent mitigation. That's just the fact. If you look at the fatality rate, it's continued to go down. I mean, I do think that a lot of this is voluntary compliance. I mean, you know, you're just not going to be able to police every single group of people every single time. And so I think as you get into this months after month, I think people do get a little tired, particularly in some of the age groups that may not be as at risk. So that's why we want to do the PSAs. That's why we want to continue stressing the message. You know, they went through a 2-week period watching, you know, a lot of people out of doors congregating in massive groups that was on national TV every single day. And I think that probably sent a signal. Some people say, well, okay, well then, you know, I need to be able to get on and start doing some other stuff. So I think that's why you're seeing, or part of the reason, I think why you're seeing, you know, some of the positivity go up in that, particularly in that younger age group. I do, though, think some of this is just the fact that you are engaging in mass testing of folks regardless of symptoms. I mean, you saw the study in Italy, almost 70% of the people under 60 didn't have symptoms in their study. So, I mean, think about what would be under 40. I mean, it would probably be even fewer would not have symptoms. So you got a lot of people who are asymptomatic who are being identified. You know, there have been stories in the press about some group was out, someone tested positive, they tested like 10 friends, they all test positive, and none of them actually developed the symptoms. And so that is part of what you're seeing. If we had tested the way we do now in March, you would have seen, you know, a lot more cases, because that was usually limited to people who were already showing symptoms, and that's not the case now. Yes, sir.
More questions?
Well, it's not a question of whether I oppose it. The voters of Florida passed an amendment, right? And the Supreme Court of Florida said that they had to complete all the terms of their sentence. And so that's kind of the issue. Do you have to complete the terms of the sentence if you were robbed and someone's convicted of taking, you know, $3,000 out of your house and they were ordered to pay you $3,000 of restitution and they didn't do it? Did they complete the sentence? And so those are the things that are being litigated. But we said, I signed the bill to implement that amendment. And so that's going to be litigated. But let's understand that the Supreme Court has identified what it meant. And the people who advocated for it stood in front of the Supreme Court to get it on the ballot and said, completing your sentence means everything you have to complete. They did that. They ran a campaign saying you had to do that. So all we're doing is basically saying, okay, if that's what the people did, then we're going to do it. But I mean, and I think that's what it means. And I think the Supreme Court of Florida said that's what it means. Now, just as a matter of what I think is justice, yeah, I think if somebody gets robbed, they have a right to have restitution paid to them. And we hardly ever talk about victims anymore in this country. And there are people that are victimized, by violent crimes in particular, who I think that we need to be standing up for. So if that didn't have that, then we would implement it as it was written. But since it said you had to complete the terms of sentence, I mean, to pay somebody restitution or to pay, some of these, the fees or the costs, those go into victim compensation funds. That's the whole reason that they have that there. So something that's very important. So I think that that'll be something that comes up and, in appeals court, at some time in the near future. Yes, ma'am.
One last question.
So I don't think, I certainly have not had my Department of Health substantiate that the protests are driving the figures with the younger people. I mean, obviously, there's a correlation there, but I wouldn't want to say that until you actually had the evidence. But as I said earlier, I do think when people see that, and let's just be clear, nothing personal against anyone here, we had months in this country where if someone walked on the beach, they were shamed on social media and by people in the news media. Is not so, even though a lot of them were social distant. California beaches, Florida beaches, all these other things. And then when the protests happen, you have massive demonstrations of people. I mean, some of these were 20, 25,000 people in California, obviously this other stuff. And all of a sudden, the social distancing took a backseat to social justice. And so the thing is, from a public health perspective, you may think that protest is the most important thing you could do as a citizen. I respect that. But understand, from a virus perspective, gathering with 5,000 people to protest something that's important to you is no different than gathering with 5,000 people to do something else that may not be considered as significant. And so I think there was a lot of mixed messages that came out, particularly from a lot of public health officials, where they basically said, we support this type of protest, but not if you do something else. And here's the thing. I think the people of Florida in particular, they want to do the right thing, but they don't want to have their chain jerked. And you remember 3 months ago, people said from Washington, don't wear masks because it'll make you more likely to get infected, even, they said. Well, now they say, yeah, we wanted the healthcare workers to have them, so we told people. Well, why would you just not tell people and be honest with them and say, look, the mask can be helpful, but there's a shortage now. We need our frontline healthcare workers. Please don't go and buy them. That would have been a better message. And so I think people see that, and I think that there is sometimes confusion, and I think that they wonder, okay, why is it okay to do one thing and not others? I mean, there are parts of this country that had really rigorous things in place where you have a family member that died. You couldn't bury your family member. You couldn't go into the hospital and see an ailing family member before they died because of stopping the spread, social distance. And to have had people abide by that, and then to see, that kind of get thrown out the window, I think a lot of people got really frustrated. I don't think they begrudged the people that wanted to protest. And quite frankly, I've always said, this has to be voluntary because the Constitution's not suspended just because there's a virus. You do have a right to protest. You have a right to go to religious services, all these other things. But I think that kind of sent a message that, hey, we're on to other things now, and I think that may have contributed. So I don't want to say that these are folks who attended the protests. Maybe that'll come out to be the case. But I do think that we kind of moved on, it seemed like, from a media perspective, and I do think that had an effect on how people do it. And my message is basically just, particularly if you're in the younger demographics, is, you have a role to just help us by doing some really basic things. When you're talking about the hygiene, basic social distance, Mayor Jimenez has things, with wearing the mask. Abide by that, and then that'll make it, I think, better for everybody going forward. As I said, when this skews this young, you are not going to see the type of clinical consequences out of this cohort than you would out of the nursing home cohort. But you know, these folks can definitely spread it around to the community. And so this is, I think it's, I totally expected to see more cases. I said in April, and I put it up on the last presentation, that I thought we would be seeing more cases than we ever had. Over 2,000 cases was easily something I thought would happen, because when you do mass testing, asymptomatic spread, you're able to identify those cases. At the same time, you know, we have to be honest and say it's skewing younger, but it's also escalating in terms of the positivity, especially in that community. You know, when we started to see the positivity go up, you could kind of pinpoint some of the hot spots around the state. So like in Collier County, that was 13% because you had the Immokalee outbreak. Martin County, that was 10, 12% because you had the Indiantown outbreak. And you could kind of go and do a lot of that. In Dade, you had a couple places. But now I think what you're seeing, particularly in Central Florida and Tampa Bay, is, you know, these are more community cases with younger people, and it's passing around the community, you know, at a rate that is higher today, you know, than it was, say, maybe 3 weeks ago. So that's something that we've got to dig in for. There are going to be PSAs coming out, and we hope that people will do that. And then I do want to kind of piggyback on what Carlos has said. You know, our reopen plan is a step-by-step process. A lot of these things that are open, restaurants, that's half capacity. And we wanted to be able to get people back in business. We need to be able to do that. But we did have capacity for a reason, because, you know, we wanted to make sure that people would go in, respect the social distance. And I think the vast, vast majority of those folks have done that. But I do hear reports about all of a sudden some place is like got the bar open, and it's like packed in there. And the thing is you know, that's not what we want to be doing right now. I mean, obviously we want to get to the point where people can live and let live, but follow the plan, follow the rules that have been put out, and I think that would be better for everyone. And so I want to commend the vast majority of the folks who are running some of these establishments for doing it the right way. But we are in DBPR, I'm going to tell them to start looking at seeing who is just not following any of the guidance, because, you know, we don't want to continue to see, even though it's a lower risk cohort, you know, we don't want to continue to see you know, this spread throughout the communities. And that may not be the whole reason, but it could be part of the reason. So we want to make sure we handle that. All right, well, thanks everybody for coming. We really, really appreciate it.